ora koutou. Thank you to everyone for joining today and welcome to the ACE RMO 2025 Canterbury webinar. My name is Sam and I am the ACE RMO consultant. We're going to start off with an opening karakia by my colleague Ashwini, and then I'll give everyone a brief outline of today's webinar.
Thanks, Sam. Kia ora, everyone. Whakataka te hao ki te uru, whakataka te hao ki te tonga. Kia mā kina kina ke uta, kia mā taratara ki tai. Ehi aki ana te atakura, he tio, he huka, he hauhu, tihe mauriora.
Thank you, Ash, and thanks again to our panelists for your valuable time. We'll move on to the panelist introduction shortly. Just a quick overview of today's webinar. We will have a lovely video to share with you all, and then our panelists will present to a presentation that we will share, and our RMO representatives will then tell you just a little bit more about the experience at the hospital. Towards the end of the webinar, there will be a live Q&A session, and then we'll close off with a closing karakia. So just a reminder to all our participants, all questions can be dropped in the Q&A box above. You can drop the questions into this box throughout the webinar. However, just to note that at the end of the session, these questions will be answered.
My name's Carl Hazy. I'm the operations team leader for the resident doctor support team.
I'm Karen Drever. I'm with the Medical Education and Training Unit here at Canterbury Hospital. So lovely to be here this afternoon. I'm glad we could go through about 10 billion different devices to finally get something to work. So I will hand you over to my other lovely panelists.
Hi everyone, my name's Matt Devol. I work with Carl in the RMO unit, so I'm the coordinator supervisor.
Kia ora, I'm Tristan. I'm one of the educational supervisors.
Kia ora, I'm Eddie. I'm one of the first year house officers.
And I'm Neve. I'm a second year house officer.
I knew I wanted to work at a larger centre because there's a lot of opportunities here to work for different specialties. There's great mentors here as well and lots of research happening if you want to get involved with that. Christchurch also has some great facilities here and great access to things like radiology, and also in terms of like teaching, where we have lots of like simulation sessions, which was really good. And then there's also like a new outpatients building as well. Yeah, I'm going to stare into the camera and be like, hi to everyone at home.
So I came over to New Zealand on my own and initially thought, oh my goodness, what have I done? I don't know anybody. And then I went down to the RDST office a week before I started work, was made to feel very welcome, got told where to find a place to live, where to go out for dinner, what different sports clubs you could join.
You know, we have the RDST and people like that who actually organised a whole week of orientation.
We had a week-long orientation where they were going through things that might be different or might be similar to what we'd have been used to at home.
When I started on the first few weeks, we had a lot of support from other PGY2 house officers.
They ran through cases, you know, you have a septic patient, what are you going to do? And just giving us helpful advice. I thought that was quite good.
So it was actually a really easy transition.
So there's a real emphasis on ongoing learning at the CDHB.
The METU teaching sessions were really good.
METU provides lots of teaching opportunities for PGY1s and 2s.
All of the house officers come together and we learn about a wide variety of topics from experts in the field.
And there was a really good variety of teaching sessions coming from like both medical and surgical sides, as well as having a lot of procedural teaching sessions as well.
I have found the RDST really easy to work with.
They were so helpful from day one, I think nearly a year ago now when I first applied.
They are very good at working with you and allocating leave and giving you the placements that you preference.
We always know where to go if we've got any issues with anything regarding work or just general life advice.
Spend a lot of time in that office.
We do.
A really special thing that we have in the CDHB is the CTCs, so they're the clinical nurse coordinators, and they're actually like really experienced senior nurses who do help deal with situations. They've seen a lot of it before. If you've ever got questions, they're a really great resource to go to.
The CTCs are probably one of my favourite things about the DHBs.
We love the CTCs.
They're so great. They triage all of your jobs on the on-call shifts. They're very protective over the doctors, I find.
Yeah.
So switched on and so supportive.
We have PGY2 house officers who wear snazzy checkmate lanyards, which means that they are very willing to be asked for help if you need anything.
Having worked for the NHS and the HSE, that the work-life balance is something I thought I was prepared for a difference, but I wasn't.
The vibe that the central city has and all the things that are popping up, I think it's a really great place to live long term and sort of be able to raise a family.
There's lots of places to eat out. The hills are right there, there's beaches right there.
I mean, there's a botanical gardens literally just around the corner from the hospital. Sometimes when I've had a really stressful day on oncology or something like that, I would just literally go on a half-an-hour walk in the botanical gardens.
New things are coming up all the time, like the riverside markets.
And it's also a really great base if you're interested in the outdoors. There's so much that you can get to.
You can ski one day, you can surf the next day. There's just
so much to
offer.
do.
I like lots about Christchurch, so I could rave and rant about it. But
and there's lots of things happening, so I think it's a really great place to be.
Just get on and do it.
But
It's the best decision I've ever made.
Absolutely.
I would highly recommend working at the CDHB. It's a very friendly and supportive environment to work in. There's a wide variety of specialties to get involved in, and it's a beautiful city. So you, come to the CDHB.
It was great. Thank you so much to those that put that together.
I think I'm kicking things off. You can hear me okay, Sam?
Yes, we can hear you great. Thanks.
Thank you. Alrighty. So as I said, my name's Carl. I'm the ops team leader for the resident doctors support team. So yeah, we call ourselves the resident doctors support team. We've given ourselves a bit of a snazzier name in Canterbury, I guess, but essentially we are the RMO unit. I guess we've named ourselves the resident doctor support team because we want to put a lot of emphasis on the word support. There's a group of 13 of us. We do live underground in the hospital, but we are accessible. And we'd love for you guys to come in and talk to us and look at rosters and go over things as much as possible. We manage we manage basically the A to Z for you guys as RMOs. So that's sort of advertising, recruiting, rostering. We deal with sort of pastoral care. We deal with leave. We deal with the booking of all of your RMO related travel, IT, pay queries. So we really are a one-stop shop in the RDST, and we're here for you guys to support you with anything you need. So we're the first people you can come to when you've got any sort of employment related query. And if we can't help you ourselves, we'll put you on to someone that can. In the RMO unit, we're doing, it's probably closer to about 75% of RMO rosters now. So about 3/4 of the rosters within Canterbury, we look after in the RMO unit. And certainly as first year house officers, all of your rosters will be done by us. It's just some of the specialties and surgical registrar rosters that are managed within the service. So we're a pretty big district in Canterbury. We have over 18 hospitals and facilities, and we stretch pretty far. At our main public campus, we're really lucky. In 2020, so I guess it was 5 years ago now, we opened our Waipapa Hospital, which has got our ED, our ICU, and a lot of medical and surgical wards in it. So that's nice and fancy and new. And then we've got over at Burwood Hospital, which is roughly a 20-minute drive from the Christchurch campus, is where all of our older persons health and rehabilitation services are based. Then we've got Hillmorton Hospital, which is about a 5 to 10-minute drive, depending on traffic, from the main Christchurch campus. And that's where all of our mental health services are based. Also at the main Christchurch campus, we have a slightly separate building, which is Christchurch Women's Hospital, and that is where all of our O&G and child health services are based. We're also responsible for for RMO rostering down in Ashburton Hospital as well. So for those of you who aren't familiar with the area, Ashburton's about a 1-hour drive from Christchurch, and we have 6 house officer roles and 3 registrar roles that are based at Ashburton Hospital, and so they're community-based attachments as well. So that's that tick for the medical council requirement that you can do in your second year. And then we also have our Christchurch Outpatients building, which is a fairly new building as well, and that's right beside the Christchurch main campus. So the next part for me to talk about is your ACE application, which I believe you guys have possibly done by now. So what we look for, so obviously we do love a cover letter, so it's great if you've included one of those. I guess a cover letter is your reason to tell us why you want to work here in Canterbury. So you can include things like, I guess, training that's specific to Canterbury that you might be interested in, family and friends, ties to Christchurch, perhaps sporting, cultural reasons why you may want to work here in Canterbury. And then the next part that's really important and we put a lot of emphasis on is references. So I believe there's requirements through the ACE process of how many references you have to provide and how recent they are and all that sort of stuff. But yeah, we do put a lot of emphasis on references. So it's really important that you've got some really good quality references in your application. And then the last part of the application to talk about is, I guess, the scoring and how that works. So we use the standard ACE ranking template that is sent through to us from the ACE team. And we do change the weighting slightly on a couple of things. And that is that we weight the references much more importantly, as I just talked about. So we put a lot of ranking weight into that, and also the professionalism part of those references as well. Cool, thanks, Sam. And now I'll hand over to Matt, who's going to talk to you about what runs we have available for first and second year.
So for our first years, we've got a range of runs, which you can see on the screen there. So as part of that, we've got the acute psychiatry runs based over at Hillmorton. We've got the acute stroke unit, which is connected to general medicine, but run as a separate run there. We've got cardio, we've got gastro, general medicine, which is a good one to get under your belt, general surgery, neurology, neurosurgery, older person's health, based over at Burwood, so that's the ward-based runs there. Oncology, orthopedic medicine and orthopedic surgery. We've got ORL, we've got, what does that say? Plastic surgery, respiratory and vascular. So we've got a good mix of medical and surgical runs there. And on the next slide, I'll explain how those, leading into, so once you've got your first 4 under your belt, we then have got second year runs, which will complement your first year runs in terms of we like to give you a good mix of medical, surgical, and of course that community-based run that you need for your medical council. So in second year, you'll have the opportunity to do sort of a more specific cardio run, cardiothoracic surgery. We offer a couple of GP placements each quarter, which is a good one for your community run. Psychiatry specialty services, so that's more the crisis resolution teams. We've got a couple of specialty runs over at Burwood, so spinal unit, peri-op, more the rehab positions, hematology, nephrology, ophthalmology, urology. We offer those runs in Ashburton that Carl mentioned, and also we send some house officers over to the West Coast as well, so that's also a good opportunity. And then we offer for the specialties some 6-month opportunities in paediatrics, O&G, ED. We offer a 6-month orthopedic acute care run, so that's based in ED, also working in the orthopedic outpatient clinic, and then a 6-month crisis resolution run based at Hillmorton as well for those with a psychiatry aimed career. then on this screen here. So for those of you who are placed in Canterbury and after you've accepted, you will get a survey through with this run block survey for you to complete. So that's where we're pre-allocated some runs for your first year with a good mix of medical and surgical, and you go through and you place where you might have special interest. So you may have a special interest in ORL, so you preference the run blocks that contain that one. So that's your opportunity to rank the blocks in preference order, and we do our best to try and allocate everyone to as high as we can so that everyone can get as close to what they want as we can. And then moving into your second year, we look at runs that'll tick off your 2 surgical, your 2 medical, and that community-based run, making sure everyone's sort of got a good rounded experience by the time you finish PGY2. So I think that is everything on the run side of things. I'll pass you over to Karen.
My name is Karen Drever and I'm one of the medical education and training officers. So we're the Me Too. We are a dedicated unit. There's myself, another MEO, Karen as well. We have Erin as admin support and our clinical director, Dr. John Thwaites. And then we have 14 educational supervisors, of which you will all be allocated one, but we can talk about that very soon. So basically we manage everything Medical Council requires of you. We help you get there. We manage all those things, all those requirements, and so your teaching, the supervision, etc. So that is what we do, and we work alongside the RDST unit. We're all in the same office, so different roles, but we really complement each other. Talks about your supervision. So as I said before, you'll be allocated an educational supervisor, and that same person will be with you for the first 2 years. Your clinical supervisor is allocated to you from within the service you work in, and so obviously there you'll go to for anything clinical. But with your educational supervisor, it's an overarching mentor, I guess, and so you will meet with them towards the end of each run and any other time that you feel like you want to have a chat. This is just telling you about the educational supervisors, which you will be allocated. Something unique to Christchurch, Canterbury area, is that we will also allocate you an educational supervisor after your PGY2 year. So you will always have someone guiding you when you apply for your vocational college. Teaching program, so dedicated teaching program every Wednesday afternoon and Thursday lunchtime. Geared towards your first and second years, but they're open to all RMOs. So anyone's welcome to join the teaching program. We do a lot of near-to-peer teaching, the different types of teaching that we offer. So lots of scenario training. Well, we try and incorporate as much as we can in the year. So we have a mix of didactic and scenario and practical type sessions. We're very lucky to have a beautiful building here called the Manawa building, and there's 3 floors of learning spaces, and the whole second floor is dedicated to practical and sim suites. And so we get to use that space quite a bit, and also running workshops. Yeah, so just some examples of practical skills sessions that we've run. A lot of interprofessional type teaching programs as well, where we get different professions in to discuss and talk about and teach around the same topics. And yep, we run workshops as well. Pharmacy workshops are really popular and something that we're really proud of. So this is a great way for you to work alongside your friendly pharmacists. So it's breaking down the barriers as well. So when you see each other out on the wards, it's really easy to find the advice and to be able to offer the advice. And so, as I say, we run pharmacy workshops. We have done some conflict management work in the past, serious illness conversation guides, goes into clinical orientation. So like most DHBs, we offer a week-long orientation now. It's intense. So we try and mix it up with some heavier clinical stuff and then just some lighter stuff. So it includes your computer application program training. You'll meet with the CTCs and you'll talk about handovers. We run one of our first pharmacy workshops. Probably one of the more popular sessions is meeting the current first year house officers, and they do a really cool handover. We talk about discharge summaries. You'll have a day in service towards the end of the week. And we also run mini expos where you get to meet and interact with a lot of other services that you will work with throughout the hospital as well. And it's exactly what it is. It's a mini expo. It's a walk around, meet and greet, and it's a lot of fun. So this was alluded to in the opening video. We run a Checkmate Mentor scheme. PGY2 house officers plus volunteer to be a Checkmate, and it's just a safe place for you to check in, ask questions, a friendly face. They are never too busy to stop and help you out, answer your question, or figure out who can help you to answer that question. So there are eyes and ears on the ground, and we've got about 100 across all the campuses now. So they're a great visual and a really awesome support network for anyone new that's starting at the hospital here. So we're really proud of that scheme. Just a few other things we've got going on. We run an RMO of the month, and the RMO is nominated by your peers. We do end of run evaluations because these are really important feedback. So it's your chance to have a voice, as is being part of the RMO training committee, to offer feedback clinically or anything to do with rostering, anything to do with support networks that are out there or they'll need to be out there. We have a sponsored running event towards the end of the year that it's a couple of laps around Hagley Park with a barbecue and a whole lot of other corporates. And we also run a weekly newsletter where we can keep you updated with what's the information that's important and relevant to you now. Yeah, so that is medical education training in a nutshell. I do have one of our educational supervisors here, so as well. So if there's any questions, I'm sure between Tristan and I, we will be able to answer those. But otherwise, Eddie and Neve.
I'm Neve. This is Eddie. Like we said, we're some of the house surgeons working in Christchurch at the moment. We'll just run through some of the slides and talk a bit from our perspective about what it is like to work here. And then obviously more than happy to take questions at the end. I moved up here mainly because I wanted to live in Christchurch. You know, I think it's an important thing to think about where you want to be when you start this sort of major transition into your clinical years. But Christchurch has proven to be a truly excellent place to work. Like has been spoken to in the previous slides, the RDST is a great source of support. They're approachable. You can walk into the office at any time when the lights are on. Same with Me Too. The rosters try their best to work with you within the limitations of obviously the system that we're working in, but you know, the team works with you to try and fit in leave for important events, or, you know, if you're having issues with your runs, personal issues, anything like that, they're very helpful. And the same goes for Me Too with the support system we have with our educational supervisors, following you up for all of the tick boxes that you need for medical counsel. You're never sort of left behind. The CTCs are something that does really stand out with this hospital. They are incredible out of hours. They filter all of your jobs that we get through the digital note system. So through Cortex, all of the nursing jobs will go to them first and be triaged before they get to us. So all of your sort of troubleshooting catheter jobs or things that can wait don't sort of make their way to you, and you're dealing with the important stuff and the acute stuff. a lot of them have had time in ICU or ED nursing. So if you've got deteriorating patients, they'll come with you, they'll do the ABGs, they'll do the ultrasound guided lines and help you, particularly in the early months. They're invaluable.
Yeah, I just like to add on that point, starting out working this year, going from being a student to being completely on call can be quite scary. And what they'll do is they'll just come and check on you throughout the night, see how the workload's going, keep an eye on the workload. And then what's even more useful is sometimes something will happen and you just don't know who to talk to or who to contact, and they can just provide ideas. They've usually seen it before. And I literally called one up last weekend and I was like, right, well, this is happening. I'm still not really sure who to talk to. Who do you think I should talk to? And then they looked at the list of other people that were on that night and they're like, oh, this person's going to be great. I mean, that's just awesome to have that kind of support to help when things do get a bit more difficult. Anyway, sorry to but yeah, I just think that they're a fantastic resource that nowhere else actually has. And like Neve said, you kind of get filtered out the jobs that wouldn't necessarily be for you or are kind of time wasting. So they're always fantastic as well. Yeah, of course, like Neve said as well, you've got to decide where you want to live. Christchurch has a lot of good things going at the hospital, lots of support. But there's also a lot happening with the city. 15 years ago probably wasn't so good, but we've been rebuilt pretty well now. Lots of cool riverside areas to go visit, bars, places. The Hagley Park's right next door if you want to go for a run before or after work. Lots of cool things to do on your kind of nights off. We've got a cool complex that's been apparently going to be finished in 2022, which I think is going to hopefully be sometime soon. It involves a gym and a swimming pool, so that's going to be nice and close. If you're trying to think of a good place to live, Christchurch is pretty good rent-wise when you're comparing to Nelson and Wellington's, Auckland's. But obviously that kind of comes down to where you want to be more than how much it costs, I'd say. So there's lots of good things. Anything you want to say about Christchurch specifically?
No, I mean, it is a great place to live, and particularly if you're thinking about like looking to buy property as well in your first couple of years, if that's something you want to do. It's a place that has lots of sort of good first buyer new builds as well, which is something that I didn't really appreciate when I moved here. So that's also something to think about. I mean, Waipapa is a glorious building. I trained in Dunedin and did like rural placements and things down there, and this hospital was pretty flash. It is nice to work in that kind of environment. It certainly helps. Like Karen was speaking about, the sim suites over on this side in Manawa, and the sort of training spaces that we have are also of a very high standard. We do have some rural placements in second year, rural out of town placements, Ashburton and also Tanekau Hospital in the West Coast. So if you want to spend 3 or 6 months out of town and work in a smaller hospital, you do absolutely have that opportunity. Cortex is pretty cool. It's the sort of, you have it on your phone and on iPads, digital note-taking system and messaging system with the nurses, coming from somewhere with paper notes. That does make your life a lot easier. Yeah.
It actually means when you're doing things in the morning, you can read through what everyone did at night. Everything's legible, one space. You don't have to wrestle 3 nurses for it.
Yeah.
Life's pretty good with Cortex, I'd say. So, yeah.
And MedChart, which is, I mean, people who I think in the South Island should be familiar with MedChart, but those up in Auckland and things, I think still have paper charting. So, yeah, have a digital prescribing system here too.
It's pretty cool that as a first year, you can kind of do lots of different runs. If you're into surgery, you can do surgery, and if you're not, you don't have to. I'm aware of other places around New Zealand that are kind of run through the same things over and over again, do multiple general medicine runs. We have to do one of those, and I'm sure it's going to be great. I haven't done it yet, but I'm not excited at the thought of 2 of them. And then obviously there's other stuff as well. So if you think that you kind of like specialty things and that's where you want to go down, if you want to do things like neurosurgery or urology, other medical specialties, oncology, you get a lot more exposure in that kind of set field if you kind of go down one of those run options. That's always pretty cool. When we start out, it's pretty friendly that you don't have nights for the first 6 months unless you're a gen med baby, and then you start after 3 months. But in gen med, you've had pretty good supervision for 3 months. I understand you've talked to some pretty cool doctors every day and had really good supervision. So you're probably a bit more guided into some of those other medical kind of situations you'd come into overnight, and you'd be pretty good with them. Yeah, weekends don't actually happen as often as I thought. I was expecting every 2 or 3, 4 weekends, and some runs do have them more. I think orthopedics is what I did last. I think that was about 1 in every 4.5 if you can split them. But yeah, 1 in 7 weekends for different runs. It's reflected on in your pay as well, because different categories have different runs, and it kind of reflects that. So weekends are pretty good as well. I've only done 2 different specialties, but and the specialist surgery one, that's been incredibly fun. I'd be happy to do that again. And orthopedics is busy, but from what I understand, most people don't mind the after hours stuff, apart from getting a little bit more tired, but
Yeah.
part of the job, so we keep ticking.
And I think it's important to remember with your weekends and your nights, even if you start 3 months in, the CTCs are there for nights and weekends, and you have extras on your weekend shifts for the first quarter as a PGY1 anyway, so you've always got sort of senior support around.
Yeah. For like on that point, there is a PGY 3+ for the first month, who you can call for any out of hours shift. And I remember I picked up a shift once in my first month, and they came and sat with me for the night because there was no other first year on. So I had a walk through guided additional shift, which I thought was pretty cool at the end of it. But yeah, no, you get good support here starting out. Everyone knows that it can be quite stressful beginning. Yeah, we've talked a lot about these guys, but these guys, without a doubt, are like the highlight of a long day. They just make it 10 times easier.
Yeah.
I came from, I did a bit of TI in Nelson, and on one of my acute shifts, I remember almost wrestling with a delirious patient for an hour and a half because they wouldn't take their medications. And that's the kind of thing that is incredibly important, but probably doesn't have to come through to the doctoring team. So just kind of things like that don't take time. Things only get escalated if they kind of need doctor oversight, or if it's an emergency kind of situation. So that's used, and they're always super friendly and so knowledgeable.
I think we've talked a bit to this as well, just around Metu's role, like Karen said, with teaching schedules, simulations, workshops. We've had teaching on ultrasound guided lines and lumbar punctures and suturing as part of our sort of teaching schedule. And I think we've spoken a lot to the support and how approachable the RDST, the Metu, the educational supervisors, the clinical supervisors are here. Cool. And yeah, it'd be great to have you guys join us.
Come along, hang out.
So first question, do we have to find our own accommodation for the out of town runs in Ashburton and West Coast, or is there support available?
Yeah, so I can probably talk a little bit to that. So with Ashburton, there's actually accommodation available down there, and I think much to everyone's I guess happiness, it got renovated. It was in some dire need of upgrading, and that was done. So I think there's a shared house that you can stay in, but you don't have to stay there. Like if you have family or friends or somewhere else you want to stay down there, you can do that as well. I think a lot of the guys actually drive back for the weekends when they're not rostered as well, and stay in Christchurch for the weekend. And the West Coast, the same. They've got accommodation there that they arrange for you whilst you're there. So that's all covered and paid for. You don't need to self-fund any of that.
Next question, how many hours does PGY1 expected to work weekly? So what are the weekly hours for a PGY1?
Maybe Ed and Eve, you guys can talk to that. You're doing it.
It depends on your category for your run. So the expected hours and the calculated pay is available in the NECAs for, remind me what the unions are called. RDA
and Stones, yeah.
Sorry, I'm post-nation. And so that's pretty well reflected in what the expected hours are for your run. So ranging anywhere between 40 hours a week with no after hours for, the E's and F's, to 60 to 65 hours for a category A. I would say that they're well reflected in how much we do actually work on the ground. I haven't encountered much issue with sort of working heaps more than expected. And if you do go through that, obviously you can put yourself up for a run review have that looked at if you feel like you're working more than you're being paid for.
Yeah, I reckon there's always a nice thought, at least, that there's different run rates in a place. Like I know some places have flat rates for all the runs. Like for example, I know Nelson's just Cat D flat, but there's definitely inequity, or like, and they're not equal, inequalities between the runs, and it's a lot different. So at least here, it's nice to think that if runs are demanding more, they are commonly reflected in kind of what category you're in. So work more, get paid more. I don't think that seems fair enough. Work less, get paid less. Good stuff.
Yeah, thanks, guys. I think, Matt, correct me if I'm wrong, I think the majority of our first year runs averagely sit around a category C. Normally, if we start getting runs that are up into the B, we start to get a little bit worried for non-relief, as in maybe we need to have a look into staffing levels there. Maybe there's not enough people to do all the work. Normally, your category A runs are your relief runs, which you normally won't do until your second year. I think we do have some category F runs, which are the psychiatry acute house officers at Hillmorton, which don't have any after hours. Otherwise, I think all the other first year runs do have after hours, apart from the nights like like Ed and Neve were talking about.
I noticed the start day for the clinical orientation, the 12th of Jan, is a week later than previous years. Is this start date confirmed?
I can probably answer that. Hi. Yes, it has been confirmed, and that's because if we stayed in sync, then you would be starting on the 5th of January, which means it's public holiday weekend start. And so it's just too much of an ask for staff and for yourselves to start that early. So they pushed it back a week. That's all that's happened. And it's the same everywhere, but that is an official start date, yeah, for orientation.
We didn't know that actually happened, but apparently once in every 7 years, they have to push it back a week. Otherwise, you'd end up doing orientation basically over Christmas and New Year.
Next question. Have heard lots of the PGY1 job is paperwork compared to other smaller hospitals. What is your perspective on this?
I think every house officer does paperwork, and it's almost impossible to get out of it. It is a component of our jobs, but at the same time, I've been on some pretty busy runs in like neurosurgery and orthopedics, and that's all I know so far. And I've got to theatre a pretty reasonable number of times. I got to go on Friday and drill some burr holes into someone's head. So. I mean, you don't get as much opportunity, I'd say, with things like lines, but that also, when you get busy and you get a super tricky line that you've got to go spend 20 minutes on, that's pretty tough. But you can always kind of put yourself out there if you want more of that stuff and just go do some of the bloods. Like we get probably 4 or 5 times a day. You could just go take them yourself if you're inclined, but you get pretty sick of that pretty quickly. So it depends kind of what you're into for that. I don't know what you think, Neve.
Yeah, I think it's part of being in a bigger centre as well that you do have more administrative workload, but that doesn't mean that you're still not doing the procedural stuff and the clinical work and the acute work and seeing the deteriorating patients. And I think, if you compare it, say, to like a tiny centre where you're working with maybe 2 or 3 other house officers and you don't have registrars, of course, comparatively, it might seem like we spend more of our day doing paperwork, but you still have to do the paperwork in the smaller centres as well as manage, a lot more clinical complexity without as much padding as we have here. You have less other house surgeons around, less regs around. And so, yeah, you're going to do paperwork anywhere. It is a part of our first year job and our second year job. It's part of our role, but it doesn't detract from the clinical experience that we get, particularly out of ours.
And I think it's also somewhat a trade-off with we do have that support out of ours to help us with things. Whereas if you were the only house officer in a hospital, you'd be running the emergency situation, you'd be putting in the lines, and you'd be doing all of this. Whilst that's great development, it's also a big ask for day 4 on the job when you're doing your first long day. But from what I understand, I haven't gone there yet, but I believe places like Ashburton and the West Coast, you get a lot more opportunity to get hands-on. So if that's what you're into, you can direct towards it.
Don't have any other questions that have come through, but if our participants think of a question that they might have wanted to ask during the webinar but didn't get a chance, who would be the best person for them to get in touch with?
So they can probably email the RDST, the RMO unit. So I can send you, is it best, Sam, if I send you our email address to pass on to everyone?
Well, on that note, on the ACE RMO website under the employer information section, all the employer information and their contact details are there, so they can be directed directly there if they have any other further questions. If it's obviously anything ACE RMO, the process of that, they're more than welcome to contact me, obviously, and all my details are also available on the ACE RMO website as well. On that note, I didn't know if anyone had any very final last comments. We've got one more question if there's no comments left. The last question is how many applicants selected Christchurch as their first pick versus the number of available positions? I guess I can touch on this. There is data that is available through previous years, but unfortunately I don't have that at this current time. So if you are interested in that, you can email me directly and I can see if I can get that through to you.
I think just to point out, last year we took 63 PGY1 house officers. So we really hope that it's not going to be less than that for next year. As to whether it would be any more, that's still being determined at this stage. I know the regions are working through those numbers, but we would expect it to at least be 63 again for the 2026 year.
Thank you so much for everybody's time today, and apologies for that slight mishap with the sound, but it's been really an amazing webinar and very informative, so appreciate everyone being here today. Ash, I'm going to call upon you to close us off with a karakia. Thank you so much.
Kia ora te marino, kia whakapapa pounamu te moana. He huarahi ma tātou I te rangi nei. Aroha atu, aroha mai, tātou ia tātou katoa. Huie tai kie.
Thank you, everyone, trying to get us all on the screen. Have a lovely evening.